That's how easy it is to treat veins. You can literally paint them away with the foam. As we move forward, remember we're tree surgeons. We go from plumbers to tree surgeons. So leak in the attic, flood in the basement, what we see and feels from here down, but the problem starts way up here. So that's the fundamentals. But technically what we're doing is we're getting rid of a bad pine tree under the skin. So we start with the trunk veins and we get rid of them, the combination of heat and a chemical agent. And we destroy the lining of the vein on contact with the heat or with a chemical agent. What's cool is when we inject that stuff in there, it destroys the lining of the vein and it's gone in 8 seconds. So we don't leave anything in here. So this proprietary foam we use to get trunk veins. It's a little more powerful. And then to get rid of the branch veins, we're going to use what we call physician-generated foam. Unlike cutting a tree down in the backyard, we get rid of the trunks first. And then the branches are hanging out in space, kind of. And so we want to go back and get them. So when we start doing that, you're probably going to feel things a little more. So you're going to get little tender knots in the legs, and that can happen over many weeks, even a couple of months. Most procedures, you feel better after a week and it's over. With this, you'll feel nothing for a week and then feel some tenderness. Now, tenderness and pain are different. So pain is it hurts when you're standing around, and tenderness it hurts when you press. So pain, very unusual. Tenderness, guaranteed. So when you press on areas of the leg, it's going to feel tender. But it's not lifestyle limiting. It's just weird, and it happens in a delayed fashion. So we don't remove the tissue out of the leg, we smart bomb it, and then your body's inflammatory system has to get rid of it. And with the inflammatory system comes tenderness, little heat, sometimes a little local swelling, not the whole leg. I make analogies with hard pimples. So hard pimple, you got this tender little knot, and tenderness goes away, and the knot stays around for a few weeks after that. With this, the tenderness could last weeks and the knots could last months. And the reason is because it's bigger, it's more tissue. So what happens at a week to 2 weeks after thermal ablation is the vein starts to heal and shorten. As it shortens, you feel like a string in your leg, like a puppet, normal again. Now, if it's painful, pain is it's hurting like when you're standing around. Is it hurting when you're standing around? Or then what can we do for that? Because these are all the things actually we want to talk about. When you wait for pain, take a pill, wait for pain, take a pill, doesn't work. You need to take it consistently, which is almost more important than the dose, like every 6 to 8 hours. And then a lot of people use too low a dose. 1,000 milligrams of Tylenol, fantastic. You could take 1,000 of that up to 3 or 4 times in a 24-hour period. On a non-steroidal like ibuprofen, Motrin, Advil, they're all the same. They're just brand names. You can take up to 800 milligrams up to 4 times in a 24-hour period. But those are the strategies. Now, what are the other things we can do? You can put some ice on it, not great for lifestyle, right? You can use frozen vegetables, and peas work better than corn. I'm joking. Another thing you can consider is eccentric compression. So, eccentric compression, a cotton tampon's probably the best, but eccentric compression, take something like this, a rolled up anything, a piece of foam, and you put it on the area that's hurting, you tape it on there, and then it really presses over the area of discomfort. So the reason the compression works is when we wear compression, it prevents pain because when we treat the veins with foam or heat, it causes them to inflame or enlarge a little bit. That stretches our nerves, that causes pain. So that's why compression helps, because it's not stretching the vein as much. And then this helps because it's not stretching that much when you eccentrically compress over the area that's tender. So it's not stretching and hurting our nerves. So that's why eccentric compression works. So you could roll up a rag or a washcloth or anything and put it under your compression, and it will help. And then activity is important. People who lay around too much after this are going to hurt more than people that just stay active. But those are all the things that we can do. You can wear 2 hose on one leg. So you can wear a knee high over a thigh high, or you can actually wear 2 thigh highs. It'll double the compression and you'll feel even better. Right. Okay. Now, if that gets any worse, or you're cussing us every 30 minutes or thinking about us, then let us know. Sometimes discomfort can come from the vein is still a little bit alive. Got to put out of its misery. So that's how we readdress it, but that is everything.
Before your next appointment, please let your vein care specialist know if you plan to pause treatment for more than 3 weeks so we can keep your care on track. Arrive about 15 minutes early. Late arrivals may need to be rescheduled. Remember to bring your compression socks to every visit. And be sure to eat and stay hydrated beforehand for your comfort and safety. Extravasation is common after RF thermal ablation. It often looks like a bruise, but typically doesn't cause swelling. This happens when a small amount of blood collects just beneath the skin. If you notice any fluid after the dressing is removed, don't worry, simply apply gentle pressure and place a new bandage. You may notice a tan or brown discoloration over the veins we treated. This is normal after thermal ablation. Vein911 Thrive, or erythema. It's caused by small iron deposits from trapped blood, and these fade naturally over 6 to 12 months. If the discoloration is still there after 3 to 6 months, it may mean the vein is still open. That's why follow-up visits matter. They help keep your legs healthy and looking their best. After your final treatment, we'll do a new baseline ultrasound to confirm your veins have closed. Your 2-month follow-up is key for checking, healing, symptoms, and preventing cosmetic issues. In the first year, many patients need another ultrasound or UGFS for best results. And for ongoing care, plan a yearly visit to keep your legs healthy.